YouTube live book reading of Clinical Application of Respiratory Care by Barry A. Shapiro, Ronald A. Harrison, and Carole A. Trout. I'm your moderator and narrator, Uriel Neville Riley. Welcome. Peace, YouTube. So we pick up in chapter 13. This is so good. Oh, chapter 13. We started out last evening, and so this is the second reading in chapter 13. Peace, everyone. Welcome. Welcome. Hi, it's Heartlow. Dosages and solutions. The vocabulary here is through the roof. The calculation of dosages delivered by aerosol is unnecessarily confusing. Since the medication must be nebulized, concentrations are labeled either by the dilution factor of the drug or by the percent solution of the drug mixture. If several facts are committed to memory and several relationships understood, the use of these solutions is simple. 1. Solute equals the drug dissolved. 2. Solvent equals the fluid in which the drug is dissolved. 3. 1 milliliter of water equals 1 gram of water. 4. 1 gram equals 1,000 milligrams. Drug dilutions are expressed in terms of grams of solute, grams of solvent. A. 1 to 1,000 solution contains 1 gram of drug. 1,000 grams of solvent. This is equal to 1,000 milligrams of 1,000 milliliters, or 1 milligram over 1 milliliter. Percent solutions are expressed in terms of grams of solute over 100 grams of solvent. A 1% solution contains 1 gram over 100 grams, or 1,000 milligrams over 100 milliliters, or 10 milligrams over milliliters. 1 to 1,000 solution is a 0.1% solution. 1 to 200 equals 5 milligrams over milliliter, or a 0.5% solution. All right, peace. Bottom of page 212. Catecholamines. The catecholamines are widely used in cardiopulmonary disease and are among the most effective medications known to man. Over 5,000 years ago, the Chinese discovered ma huang, an herb very successful in treating respiratory disease. The alkaloid ephedrine was isolated as the active ingredient in ma huang at the turn of the century. Shortly thereafter, the vasopressor action of adrenal gland extract was demonstrated. This adrenal gland activity was the basis for naming the sympathetic nervous system the adreneric nervous system. The adrenergic nervous system. All right? Here we go. We got to drop a pin there because that's the sympathetic nervous system. Ding! You have to, right? Thank you. Peace, YouTube. Highest heart love. Welcome. Thank you for reading with us. We're in the 13th chapter, second reading, episode 35 of Clinical Application of Respiratory Care by Barry A. Shapiro, Ronald A. Harrison, and Carole A. Trout. We're over here on page 213. All right. We just have got the eclipse energy on the adreneric nervous system. In 1904, epinephrine was isolated and quickly became the prototype for all catecholamines. When epinephrine is injected into a dog in appropriate dosages, the blood pressure responds as illustrated in figure 13.2. The initial vasopressor effect was named the alpha effect. The secondary vasodilating effect was named the beta effect. The receptor theory was soon put forth to explain these various effects. This theory is still universally accepted. All right, so here we go. You have the mean blood pressure on the vertical axis, and then the time on the horizontal axis. You see the epinephrine right here, where it's injected or put into play, and the alpha response wave. And then you'll see the beta response wave. Okay. So thank you so much for reading with us. This is Clinical Application of Respiratory Care in the 13th chapter. This is a second edition. MCAT and respiratory. See that? Therapists. Information. Thank you so much for being here and reading with us. We're pushing to 1,000 subs, reading books here on YouTube. So highest heart, love, and honor. Thank you so much. Thank you. Say, get your popcorn. Thank you, Isabel. Highest heart, love. All right. Here we go. The bottom of page 213. The autonomic receptor theory. This is very key. The autonomic nervous system does not come in anatomic contact with the target cells. Rather, a chemical substance is released at the nerve ending that crosses a minute fluid gap and stimulates a receptor located on the cell membrane. This receptor activation is responsible for the reaction in the target cells. Page 214. The sympathetic nervous system has two categories of receptors, alpha and beta. Alpha receptors are located mainly in the arteriolar vascular smooth muscle. When stimulated, they cause constriction of that muscle. Beta receptors are also located in the vascular smooth muscle and have a weak dilating effect. Beta receptors are mainly located in the heart and lungs. Beta 1 receptors are on the heart cells and cause the myocardium to contact more rapidly and with more force. Beta 2 receptors are located on the bronchial smooth muscle cells of the lung and cause active dilation of that musculature. Alpha drugs will cause mucosal vasoconstrictions and peripheral vasoconstriction or blood pressure up. Beta drugs will cause tachycardia, arrhythmias, and bronchodilation. Although these are profound generalities, they will serve the respiratory care practitioner well. Autonomics and the lung. The tracheobronchial tree is supplied by both sympathetic and parasympathetic nerves. Stimulation of the sympathetic nerves primarily results in active relaxation of bronchial smooth muscle. Stimulation of parasympathetic nerves primarily results in increased glandular activity and constriction of bronchial smooth muscle. The sympathetic nervous system is believed to accomplish bronchodilation by stimulating the beta 2 receptors and causing relaxation of bronchial muscle. Therapeutically, epinephrine or related catecholamine drugs may be administered systemically or by inhalation to accomplish relaxation of airway musculature. Peace, peace, highest heart, love. Welcome, YouTube. Thank you so much for being here and reading with us. We're doing it, right? We're in the 13th chapter. I know. Thank you, John. Clinical application of respiratory care. We are in the 13th chapter, page 214. For those in the replays and in the playlist, we read books here on this channel, and it's a peaceful place where we read books and learn from masters. I'm a master fitness trainer, Master Uriel Neville Riley. So thank you for reading with us. This is super high vocab time, and we are in mode. Happy Friday. Much love to all of you. All the book lovers community, we love you so much. Nice heart love. Live from the light here in LA. All right. Stimulation of the sympathetic nerves primarily results in active relaxation of bronchial smooth muscle. Stimulation of parasympathetic nerves primarily results in increased glandular activity and constriction of the bronchial smooth muscle. The sympathetic nervous system is believed to accomplish bronchodilation by stimulating the beta 2 receptors and causing relaxation of bronchial muscle. Therapeutically, epinephrine or related catecholamine drugs may be administered systemically or by inhalation to accomplish relaxation of airway musculature. Bronchial smooth muscle can be made to contract by chemicals such as histamine or choline or by stimulation of the parasympathetic nerves. Historically, drugs that block the parasympathetics, such as atropine, have been used for bronchodilation. Mechanisms of bronchodilation, down at the bottom of page 214. Although bronchodilating drugs have been successfully used for decades, the mechanisms through which they work have been discovered only within the last decade. The beta receptor on the smooth muscle cell is associated with an enzyme called adenylocyclase. When the enzyme combines with the beta sympathetic drug, intracellular adenosine triphosphate, ATP. Yes, we got her. ATP, ATP. This is critical. Ding. Intracellular adenosine triphosphate, ATP, is rapidly converted to cyclic AMP. Intracellular levels of CAMP are responsible for relaxation of the muscle fiber. Thus, increased levels of CAMP result in a series of biochemical reactions resulting in relaxation of muscle fibers. Decreased levels of CAMP favor the reestablishment of bronchospasms in susceptible muscles. Peace, highest heart love. Thank you, nice. What's going on? Welcome to the peaceful part of YouTube where we read books and learn from masters. And we just hit a big pin in learning about ATP. This is what sets off the reactions from the mitochondria inside of our DNA, inside of the muscles that let them explode into action. All about the control of the muscles. And this is so big. Dealing with bronchospasms. We're in the 13th chapter, Pharmacology and Bronchial Hygiene Therapy. Top of page 215. Another intracellular enzyme, phosphodiesterase, is responsible for metabolizing CAMP. Thus, CAMP concentration may be increased by inhibiting the phosphodiesterase the phosphodiesterase. This is the pathway by which the methylxanthines and the theophylline and the aminophylines achieve bronchodilation. In other words, all bronchodilating drugs cause an increase in CAMP levels, either by increased production or decreased breakdown. In general, catecholamines increase the production of CAMP. Other bronchodilators decrease the breakdown of CAMP. Non-inhalation pulmonary agents. Non-inhalation pulmonary pharmacologic therapy may be broadly categorized in 7 areas: bronchospasmolytics, decongestants, mucokinetics, anti-inflammatories, anti-allergics, anti-infectives, and antitussives. Bronchospasmolytics. Bronchospasmolytics are drugs used in the management of bronchospasms. They may be categorized as active bronchodilators and preventatives. Active bronchodilators are either catecholamines or methylxanthines. The former increase production of CAMP. Methylxanthines are phosphodiesterase inhibitors, which decrease the rate of breakdown of CAMP. Epinephrine. Epinephrine, adrenaline, is the classic catecholamine. It has strong alpha and beta action and is both beta 1 and beta 2. Given subcutaneously, it is the standard therapy for acute asthma. Ephedrine. Ephedrine is similar to epinephrine and is the most common catecholamine oral bronchodilator. The dose of ephedrine needed to cause an optimal beta 2 effect would result in severe beta 1 effect and significant central nervous system stimulation. Therefore, it is usually given in suboptimal doses in combination with theophylline. Theophylline, the most important of the methylxanthines for oral bronchodilation. In optimal beta 2 doses, it is extremely irritating to the stomach and causes excessive central nervous system stimulation. Suboptimal doses of both ephedrine and theophylline often are matched with a tranquilizer or sedative. Such combinations form the foundation of oral bronchodilators in the United States, e.g., Aim, Amisec, or Bronchotab, Marex, Quadrenal, Tedral. Newer oral bronchodilators are effective and have fewer side effects. These have been used extensively in Europe. Metoprolol or salbutamol or terbutaline. With their appearance on the American market, they will undoubtedly change present clinical regimens and concepts. Aminophylline is theophylline dissolved in ethylenediamine for intravenous use. It may be given rectally or orally. And that's what we'll pause for right now. Continue back in the 13th chapter. Look at this. We're at page 216. Woo! This is amazing. Amazing. On this 35th edition of book reading, clinical application of respiratory care. Super high level vocabulary. I will make sure to put it into the the description when I upload. Woo! Shaking it up in the world, reading medical books. Here in this peaceful part of YouTube where we read books and learn from masters. Thank you so much for reading with us. If you don't understand the vocabulary, well, that's why I read it on here live, because I know that you can replay it and then you can go in and do your research and look up the words and, super high level. So I'm a master. I don't expect you to be able to do what I do. I just want to give it to you, these $1,000 of information for free, because that's what light workers do, right? That's what we do. We love on the people. We protect the ones that are disadvantaged. And that's why part of being a light worker is it's giving you the ability to make a choice and to learn to master yourself. Thank you so much for reading books with us. I love you. Because it's just amazing, how far we've made it to shaking it up from having I started reading books on here with like 35 subs. And now we're well over 500 subs. Shaking it up in Virgo season. Yes! Woo! Hey ya, hey ya, hey ya, hey ya, hey ya, hey ya, hey ya. Hey ya, hey ya, hey ya, hey ya, hey ya, hey ya, hey ya. Woo! Highest heart love. Thank you so much for reading books with us, shaking it up, making the dummies look even dumber, making the smart and bright lights shine like night. We did it again. We are doing it. Thank you so much for being here, man. Highest heart love. Let's have a drink of love water. Shouts out Dante Davis, one of my favorite friends in the light worker. Home, happy solar return. Much love to you. We uplift you. We support you. All your endeavors. Keep shining. To all my nieces and nephews, I love you so much. My family and friends, all my mods, thank you. Keeping the chat clean. Highest heart love. Cheers to another great day, evening. I love you. I love you. I love you. Oh, so good. I love you. I love you. I love you. Love water for the people. Highest heart love. Thank you so much. We're pushing. Thank you for the subs. Thank you for the likes. We're doing it. Look at us pushing now to 1,000 reading books in this peaceful place on YouTube. Nice, clean, sacred space where we read books and learn from masters. Guys, Harlow, thank you so much for going through the playlist on the books as well. I see y'all reading some of these books. Y'all like, I just see the numbers just keep going up and up and up. And I'm like, wow, they are reading the books. So thank you so much to all the book readers. We're part of the book lovers community. Hi, it's Heart Love. The Imagine Center for Light Workers. We are the healers. We are the light. I want you to have a wonderful evening and rest. We're going to the light green cloud this evening. Oh man, it's going to be so great. We're going to be making some green juices and oh man, healing. We're going to be learning about the pressure points. So it's just going to be beautiful. I'll be teaching a class on the 322 pressure points. We're going to start with the hands and feet, how to release the lymph drainage and so on and so forth. So, highest heart love. Thank you so much. We're going to do the right and the left hand. And then tomorrow we're going to do the left and right feet pressure points. So, sending you love. I love you. I love you. You know I love you. I love myself. I'll see you in the clouds evening. All right? Peace, peace.